Gennev is basically a virtual care platform for women in menopause. We are, if you were to think about us, we're an online clinic. You can see an OBGYN specializing in menopause care. You can get a prescription. You can work with a health coach on lifestyle changes around nutrition and fitness and mindfulness and sleep. You can also purchase over-the-counter products, supplements, or hygiene products that help with symptoms. But most important, you have access to free education. And so our mission really is to improve the standard of care for women during their post-reproductive phase of life. That's women kind of ages 40 plus. And, to date, we're serving women in all 50 states with our clinician team and just really filling a gap in the healthcare space that has existed.
Can you share your perspectives on what are some of the biggest challenges that women face today as it relates to their health and wellness?
Yeah, I think more than anything, we're not educated about our health and wellness after we have children. I think there's good and sound education around menstrual care and around pregnancy. It's getting better around fertility and postpartum. But when it comes to menopause, we never have that menopause talk. And worse yet, there's very little research or even education in the healthcare space around menopause. Primary care physicians receive little to no education about menopause during their formal studies. 1 in 5 OBGYNs take the elective course on menopause. When you think about the problem, it's lack of education amongst women, it's lack of education amongst doctors, and it's just been the perfect storm for women being really underserved in their healthcare at this part of life.
Yeah, and it's really shocking that most women aren't prepared for menopause when it comes. I think we all know that at a certain age it's going to happen to us, and just the lack of education around that, even in 2022, seems very surprising to me. So at what stage in a woman's life cycle could she benefit from using the services that Gennev offers?
Typically when we think about post-reproductive, it usually starts in the 40s. The average age of the customer or patient that comes to Gennev is 45. And so and for some women, it starts earlier in their late 30s. But typically, any time between that 40 and age 50, you're going to start to feel some changes in your body that are somewhat unexplained. And also, I guess one additional point, when a woman, just to give you the Menopause 101 education, menopause itself is one day in a woman's life. It's when you hit that 12-month mark of consecutively no menstrual cycle. And any time before that is perimenopause, and any time on the other side of that is postmenopause. So that can be a full holistically 20-year journey, because perimenopause can go up to 10 years, postmenopause for 10 years. And so we typically see women in that perimenopause phase of life in their 40s and early 50s coming to Gennev, partly because they're going through these changes for the first time and they're wondering what's going on. And number two, that's when a lot of the symptoms are the most severe. It's before you hit that 12-month transition point. And so that's when we're seeing the majority of women seeing our physicians and using our content.
We were chatting before, there's a lack of research on female subjects. Menopause is an elective course in medical school, and only 1 in 5 doctors is actually taking it. Appointment availability with OBGYNs can be scarce and very limited, and you come in and offer an opportunity to connect with real doctors and clinicians, in many cases multiple times a year, to make sure that patient has a good standard of care. Can you talk a little bit how the woman would use Gennev in terms of both the telehealth services and then the supplements and the prescriptions and everything that she needs to support her on her wellness journey?
Yeah, you summarized it so well. And just one data point, 1 in 5 OBGYNs take the elective course on menopause. And then primary care and GPs, they just don't even have that offered in their education. So again, going back to that, there's a gap in healthcare around specialists or educated doctors in this space, and that's what we're hoping to fill. So when a woman comes to Gennev.com, the first thing we recommend for every woman is take the menopause assessment that we've created. It answers kind of the top two questions we get from women. Number one, am I in menopause, and how long is it going to last? Like, where am I at in the journey? We slot her into one of 5 phases in that journey, so she truly understands, okay, these are the symptoms I'm experiencing, and this is where I'm at, and how long it's going to last. From there, our physicians use that data. So from there, we encourage a woman to book an appointment with a doctor. It's a 30-minute appointment, virtual telemedicine, just like kind of this interview is now. And so you're talking to a real clinician. She's got your intake from that assessment as well as your medical history. And you have a 30-minute conversation about the whole you, everything that you're experiencing. Our doctors will ask you those right questions that don't typically get asked in a traditional primary care or regular clinician appointment. And from there, our doctors have kind of a 3-point prescription or personalized care plan toolkit, we call it. It could consist of prescription support. So we do prescribe a lot of hormone therapy or even low dose birth control to help minimize and manage symptoms in women. It could also include more lifestyle care. We have a team of health coaches who are dietitians that work more on the natural side, nutrition, fitness, sleep, mindfulness, so that the woman is getting both medical and lifestyle care to manage her symptoms. And then the third area is over-the-counter products that can help her. Do you need a supplement, like a vitamin D supplement or a multivitamin or a lubricant for feminine dryness? Our providers are going to also talk to you about just products that are great for over-the-counter symptom relief. As a result, 94% of our patients report improvement in their menopause symptoms through that process. And all in all, it's really a new standard of care that we're trying to bring to women.
And Jill, you've built Gennev as a women's health platform, and there are other areas besides just menopause in which women have been underserved. Can you talk a little bit more about how you see the evolution of that platform and then the other types of issues that you plan on helping women with?
Yeah, I often, when I said earlier, our mission is about improving standard of care for women during her post-reproductive years. Post-reproductive means when you're done having children until the end of life, essentially. And that's our vision. We want to grow old with women. Menopause is kind of the kickoff or that entry point where your hormones are going to start to shift that prepare you for the second half. And how you treat your health during menopause, whether it's with prescription support or lifestyle change, directly impacts long-term health, particularly cardiovascular health associated with heart disease or hypertension or cholesterol or even diabetes, bone health and osteoporosis or osteopenia, and then of course brain health, dementia, cognitive changes, even Alzheimer's. And so our vision is that over time, we add those specialties and even ones in between, whether it's pelvic floor therapy or GI support for women as she really navigates her healthcare during the second half of life. Ideally, I want to help present her with that roadmap and then be her partner, if you will, starting with menopause and really helping her navigate that, whether it's using Gennev clinicians or partner clinicians in her own kind of local network.
With the pandemic, we've all realized the importance of taking care of ourselves more. I think that's almost felt like a luxury that maybe women didn't have. We take care of everybody else first, and sometimes if there's leftover time, you take care of yourself. Are there any other trends in the wellness landscape that you're focused on over the next few years?
I think more than anything, personalization of your healthcare is a huge trend happening. We like to say we are persona-focused healthcare. We know and are continuing to educate ourselves on this persona, women 40 plus. I'm one of them for sure, so I operate this company from a place of being a patient and a customer of it myself. But when you think about healthcare across bridging medical and lifestyle care, It's all one. You've got to have the two talking to each other. You need care providers talking to each other, and you need it personalized back to a woman. In this case, menopause consists of 34 symptoms. Every woman experiences those 34 and different combinations of them differently than your sister or your mother or your friend. And so really personalizing our care associated with that data we're collecting on the patient up front, and then longitudinally tracking that data to keep her care personalized to her.
Jill, thank you so much for being here today and sharing your perspectives. It's been incredibly insightful.
Thank you, Lauren, for having me. It's always fun to talk about what we're doing, and so glad you're building this platform to educate and build awareness. So thank you.